Today we're going to discuss medical ethics. Ethics refers to moral principles that govern a person's behavior or the conducting of an activity. Medical ethics are concerned with whether a healthcare worker's actions are right or wrong. They're often formed from our morals. Morals are a person's standards of behavior or beliefs concerning what is and is not acceptable for them to do. Morals are formed from our family, from life experiences, and from our culture. Think about some of the morals that you have formed based on your family, life, experiences, and culture. Ethics versus laws. Ethics is what is considered right versus what is considered wrong. Ethics are based off of morals and opinions. Sometimes violating ethics is illegal, sometimes it is not. A law is what is legal or illegal. It is decided upon by the government and it is not arguable. It is always unethical to break the law. Ethics in healthcare. Each hospital, organization, and medical practice carries its own code of ethics for doctors, nurses, and healthcare providers to follow. Violating the code of ethics can result in termination of employment. An ethics committee in healthcare facilities considers ethical problems that affect the care and treatment of patients. Members of this committee might include doctors, nurses, consumers, and members of the board of directors. The ethics committee forms a recommendation for how to resolve an ethical problem and presents it to those responsible for resolving the problem. There are many ethical issues for which no ethical code covers. These are considered ethical dilemmas and must be discussed on a case-by-case basis. Some examples of ethical dilemmas include end-of-life care. Should a patient receive nutrition? What about do not resuscitate orders? Another example of an ethical dilemma is euthanasia. Should a patient be able to choose to end their own life? A third example of an ethical dilemma is patient rights. Should a patient have the right to refuse treatment? Think about some other issues that you would consider to be ethical issues. Why do you consider them ethical issues? Think about how you believe ethical issues should be addressed in the medical setting. For instance, how would you address a teen who does not want a medical procedure that their parents are adamant they received? How should this situation be handled?